The information expressed in the following podcast is intended for educational purposes only and was created by and belongs solely to Believe Limited and the Flow podcast and does not necessarily reflect the views of our sponsors. Please speak to your healthcare provider before making any medical decisions.
Hi, I'm Jessica and welcome to Flow. I'm here with Sarah Watson, sex therapist, and we are honoring Bleeding Disorders Awareness Month with an interview all about rare, very rare factor deficiency, specifically factor 7 deficiency. This interview is with our friend Stacy, but before we get into it, we want to ask you something. How's your flow? Welcome once again to Flow. We start off Flow with that quick question to normalize the reality of menstruation. How is your flow, Sarah?
Sweaty. I just ovulated. And is ovulation a correlation to night sweats? Who knows? Super painful too this time around.
I was going to say, if you're having pain, then there is some kind of inflammation or like expansion that's causing that pain within the body. So doesn't that like push liquid out of our skin? So is that how the lymphatic drainage works?
I don't know. Maybe.
Because traditionally, I've had like night sweats my whole life and as part of PMS. Like at least one night of like sweaty bed.
Right.
Do you not get a sweaty bed? Oh,
No.
you just glisten, huh?
I just glisten on my upper lip, you know?
Oh, cute. That's rock and roll. That's also like
So fun.
boxer.
Yeah. Boxing in bed. That's another thing we could be talking about, but we won't go there today.
So you can feel like you are boxing yourself. You're
Yeah. I feel
Fight
like
clubbing
maybe,
yourself.
the ovaries are fighting me,
yeah.
right? Like,
In ovulation, they're doing this thing
oh my
to
God.
their little
Yes.
ovary sac.
100%.
I mean, so ovulation pain, again, different than premenstrual pain, different than premenstrual sweats, but it's all sweat.
Yes.
It's all lymphatic drainage.
Yes.
That is like kind of a buzz of what's around right now to take care of your body.
Right.
Make sure you're sweating.
Sweat it out. Sweat it out.
Sweat it out.
Yeah.
And that's good when you have bleeding disorders, a good sauna sweat. I don't know. Is there any watch outs as we honor Bleeding Disorders Awareness Month this month?
It's okay to sweat. That's not for me. I'm already sweaty enough without a sauna.
You would not choose to do a Bikram yoga class, would you?
I'd rather eat my eyeballs.
Okay.
Yes. Welcome to How
Would
About
you,
This.
at home, would you listeners rather take a Bikram class or eat your eyeballs?
Let us know.
Let's choose a side. Let us know in the comments. We're excited to share our interview with Stacy. Oh my gosh. Actually, I want to say this now. Stacy and I first met at the Conference for Women and Teens in Michigan. Do you remember, Sarah?
Oh my gosh. It was a dream. What a dreamy weekend. I loved it so much.
What a special time to connect with those in the bleeding disorders community who menstruate. We are looking forward to sharing this interview. But before we get into it, we're going to take a quick break to hear from our sponsor.
This ad is brought to you by Von Vendy, Von Willebrand Factor Recombinant.
Hi, my name is Nicole. I didn't always feel empowered to speak up for myself or ask for the care and support I needed. Becoming part of a community and hearing other people's experiences helped to change my perspective. That's why my deciding factor is making my voice heard. To hear my story and access other helpful resources, drop by Von Vendy, that's VONVENDI.com/patient-stories.
How to sing along with it. It's Bleeding Disorders Awareness Month. Sarah doesn't like musicals. I was trying to make a song about Bleeding Disorders Awareness Month.
Let's not.
Canceled. I'm not going to do it anymore.
I'm out of that. See you later.
Sarah, what a month to take a look at rare factor deficiency, which is absolutely part of the community of bleeding disorders experiences. But what an interview. I learned so much. I had no idea the like depths of what one goes through when you have a rare condition.
Yeah. You know, I think the fact that Stacy continued their unrelenting advocacy and it was so profound. They continued over and over to get the appropriate diagnosis and freaking access to treatment. Like,
yeah, how many different treatment centers did they have to go through?
I think 3 at least. And that was
Everything,
all they had
yeah.
in their state, and they had to go to every single one. That's insane to me. But also, I get that because I went to a couple myself too. So
Well, it's just the continued effort. The
yes.
continued effort that goes along with getting treatment can't
Mhm.
be understated. And that's why we're spending this month's episode talking about that effort, applauding that effort.
Yes.
Some who don't want to have to deal with things that take more effort, some would call challenging or
Yeah.
difficult. Just to make some noise about what you need to get your needs met.
Whether you're a bleeding disorder or not, endo or anything else, that we have to continue to show up and be loud and be deemed as a pain in the ass.
I mean, the biggest thing that I had dealt with was trying to navigate a system that's broken. It is broken as a patient, it is broken as a provider, and I'm in a state that regulates healthcare as if it's an industry, essentially. New Jersey has protections for hemophilia. They have protections saying that the insurance policies that you're going to get through any sort of marketplace or state-based insurance has to cover clotting factor and they have to cover it. However, the issue that you run into is that we have 3 treatment centers in the state. And the 3 treatment centers that we have in the state, 2 of them are owned by the same hospital system. And that hospital system does not like to recognize women with bleeding disorders or females assigned at birth with bleeding disorders who are not von Willebrands. And having a rare disorder where you're 1 in 500,000, which we're finding out is not necessarily the right number anymore. It's more like 1 in 300,000. But when you're 1 of 300,000 in a state with 9 million people, and they tell you, we've only had 4 of you ever, there's no charted way to handle the treatment. And that becomes frustrating because you go in expecting them to help you. And they go, we don't know what to do with you because your numbers are normal. Get out of my ER.
Your numbers are normal, but your symptoms are severe and deserve treatment. And
right.
The qualification of being rare means what? You have to constantly bang on the doors and remind people of what you are, what you have, and what's needed, and you will be denied. And how does one stay, out of survival needs, but how does one stay focused on getting things done when you have to have these conversations that seem insane to have?
Yeah, staying focused is obviously a hard thing for anybody when you're trying to navigate the healthcare system, especially as a rare. For me, a lot of it was pulling the research, finding the research, bringing it in, going, the research is, most recent here. Look at this paragraph. I'm not that one paragraph that you had in a textbook 50 years ago. Research is constantly changing. What we're finding out is evidence-based practice constantly changes. It changes minute to minute. It changes, month to month. No 2 times are going to have the same level of evidence-based practice. And when it comes to advocating for yourself, it's a matter of being persistent and being, I hate to say it, annoying. And I have been annoying at every HTC in the state, to the point where I've been through 5 HTCs between New Jersey, Pennsylvania, New York, Minnesota. I've been through 5 HTCs. And I have found that the only time that I was able to get any sort of treatment plan was when I was working hematology oncology in the same hospital that I was being treated as an HTC patient. And these were the doctors I was working with, side by side.
Maybe my tests are showing up this way, but my symptoms are this way, to really,
right,
reclaim and state again, to be loud, be loud about it.
Let's be loud.
Stacy's a great example of that. Stacy did a lot of that work. Well done.
Absolutely did.
What could you tell our listeners about your extreme period and extreme period experience?
Oh man, my extreme period experience. There's so many. I have factor 7 deficiency, which is a rare bleeding disorder. I am a qualitative defect, so my percentages show up in the normal ranges, but my clotting times are always off. And we recently found out through one of the genetic studies that I carry variants for different bleeding disorders, not just factor 7. So we haven't quite looked into that yet, but we're getting there. But with extreme periods, a lot of the time I have issues with severe pain. I get cramps that radiate down to my toes. And I believe the worst one that I have ever had was post-surgery. I had spinal surgery at 17, which is how I was diagnosed. And from there, the first one after surgery.
Sorry, just to back you up, you had spinal surgery not for your blood disorder, obviously. So you were having that was when you discovered your diagnosis of factor deficiency.
Right. When I had spinal surgery, the surgeon was meticulous in the labs beforehand. And that's how they figured out I had factor 7 deficiency. So if it wasn't for that neurosurgeon who was very thorough, I would not have been diagnosed.
Wow, that neurosurgeon, which was a different department than hematology, requested those tests.
Yeah, he requested a full workup of clotting times and all of the blood labs for, checking for blood cells and anemia and everything else. He wanted to make sure everything was good going in.
But you had any symptoms of indicating of a blood disorder prior?
Most of the time growing up, it was attributed to how active I was. I was involved in sports constantly from the time I was like 3 or 4 years old all the way up to high school. Most of my bruising, most of my issues were attributed to the sports and being active. My nosebleeds, it was just you're going to have nosebleeds. Everybody has nosebleeds. Same thing with getting my teeth out. It's just, why are you eating foods that you shouldn't be eating after having your teeth pulled? Stuff like that. It was one of those things that we never really looked into, the factor 7 deficiency, until after we had the lab work showing that the clotting times were off.
Now that was at 17 though. Were you already menstruating at the time? Had there been any menstrual indications of a blood disorder?
Yeah, I had already been getting my period. The issue that I ran into is I had a parent who was blind. And I had a very old school parent who was blind. And being Jewish, there's that whole, tradition of being slapped across the face. So it was one of those things that I, got slapped across the face at 13 and never talked to it again. So it's very different now compared to, 10, 15, 20 years ago.
Was there any school-based education for menstruation outside of that?
So New Jersey requires sexual health education starting in about 3rd grade. And they do teach most of the stuff. However, they do the whole dividing of the class where the girls go with the girls and the boys go with the boys. And they get into the overview of everything. But they don't necessarily go into extreme details. They give you the diagrams, they show you, these are your ovaries, this is your uterus, this is your vagina and stuff like that, and go, from there into, this is what happens when you get your period. But they don't exactly tell you that it's blood. They don't tell you any of the details. They don't tell you, hey, ovulation can hurt. They don't tell you anything other than the basic overview. And
so did you have any indication that yours were different than what would be the norm, or were they different than what you considered them?
I don't think I had any indication of them being abnormal. It wasn't until I got to nursing school that we actually went into it. And even at that, going through nursing school and having them write about it in textbooks and then skipping over it until you got to OB. By the time you get to OB, you're, 3rd or 4th year of nursing school. So by then it's like, you're already having your period for 10 plus years. So by then it's just like, is this really, relevant now? But as I got older, things became more obvious than when I was a teenager. Looking back now, when I was in high school and I was constantly bleeding through my pants and having the permanent hoodie tied around my waist, that was probably the first sign that things were not normal. That was like the blatant first sign. But there's other times where it's just like, you're going to have cramps. Well, how bad are they? Well, yeah, I can get along through my day, but it's like, for me, it's if I have them and they're radiating down to my toes, I don't want to move. I don't want to walk. I don't want to do anything but lay there. And it's really hard to explain that there's a different level of pain. There is normal everyday pain where I can work through it, and then there's pain where it's distracting me and I can't focus.
They've done recent studies about the pain of a heart attack is similar to the worst of cramps for menstruation. And so, yeah, there's been a lack of understanding. Have you experienced dismissal by doctors directly for such pain?
Yeah. I've had issues with doctors dismissing pain, or they tell me, oh, it's PCOS. Oh, it's not actually that bad. Just, take anti-inflammatories, exercise more, lose weight. Like, those are their big 3. And those are the 3 that they repeat over and over and over again.
Do you have PCOS? Is that something you identify? Do you have?
So when I was working with a endocrinologist when I was living in Minnesota, I am non-binary. So things are a little bit different when you're dealing with somebody who is non-binary, when you're getting, care managed. When I was working with the care out there in Minnesota, the endocrinologist I was working with was very good about testing everything. And even though on the ultrasounds I show up mostly normal, all of my ovarian, cysts are standard cysts. They're follicular cysts that'll rupture during ovulation. It's not like I have polycystic ovaries, but I do have symptoms of the metabolic syndrome with it. So with that comes the issue of I meet 2 of the 3 criteria for PCOS, but I don't meet the full criteria. So I've been lucky that the doctor out there has labeled me as having PCOS, but mild. And now they're starting to look into other conditions that are similar to that, or labeling it as PCOS, even though they're 2 of 3 symptoms.
Well, and there is this whole contention of how many symptoms really qualifies it. Well, we have to put the marker somewhere. Will the treatment help is the question. Is there any treatment options you've pursued that have been helpful to you, whether or not it's PCOS, no matter what it's determined as, your experience?
Right. And the big one for treating PCOS is birth control. That is the big one that they go to. Birth control and medications that will reduce the insulin resistance. In my case, I don't have insulin resistance, but I do have a history of I have a family history of diabetes. So they're concerned about the metabolic syndrome more than anything else. But as far as birth control goes, I have one experience with it, and it was not a great experience. So it comes down to knowing your body and knowing what's best for you.
And what was the kind of birth control, and why? What was the experience?
So for me, I was on something called Slind, which is drospirenone. It's a progestin-only medication. I have a history of migraines with aura, which basically disqualifies me from any birth control that has estrogen in it. And then I also have a carrier mutation for factor 2. So I'm more likely to throw a clot than the average person, but I'm also a bleeder. And hematology, for that reason, doesn't want me on anything that's estrogen containing. So for me, they put me on a medication called drospirenone, or Slind, which is progestin only, and having a history of depression with progesterone-based medications does not always work out well. So for me, it was an absolute disaster. Now, I have friends who are on medications like this that do great, and it helps them immensely. But for me, it was a disaster. I was out of my mind. I was not sleeping. I was constantly ragey. I was absolutely off the walls over little things. I was upset my dad was breathing on the other side of the room. Like, it was not a good time for me. And at the same time, I'm doing grad school. So once I got to the 3rd week of the medication, I'm like, I can't do this anymore. And I just stopped. And that, again, is not necessarily the greatest idea to do. And you shouldn't be doing this unless you have, medical supervision. But having a nursing background and having talked with the doctor about being put on the medication in the first place, I didn't want to be on it. I didn't want to be on this medication to begin with, but I was on it because they told me if they put me on it, it would give me a chance to heal from some of the ovarian cysts that I had blood into, especially the one that I was in the ER with. So their methodology was to shut everything down to give me time to heal.
But
in doing that, it ended up being a mental health disaster, which again comes down to knowing your body.
Well, and working within a system that severely under-recognizes the impact of such hormonal shifts and what, prescribes
Right.
things
And
without the consideration to their...
They don't necessarily educate people on this too, because the thing is, it's there. It's written in the fine print that if you have a history of depression or any sort of mental illness, it can worsen it. Mm-hmm. But again, they're not looking at the fine print. They're looking at their overall bias of their entire population of patients they've seen and treated.
Sarah, so let's talk. Bleeding disorders wise, factor 7 deficiency is how rare? Do you know? Are you familiar with the condition?
Absolutely familiar. I am unclear. In my world, it's really interesting. Obviously being a bleeder myself, we are not like, hey, like every once in a while, like, are you what factor are you? But we just don't talk about it so much. Like,
Sure.
I'm like, what factor are you missing? Right? Like, so I am sure 100%.
What's your sign? What
What's your
factor
sign?
are
Yeah,
you
what-
missing?
exact- I'm a Leo. I am factor 8 deficient, some anemia, and a mom and a therapist and a sexual health therapist. I mean, that should be on my bio.
I love your stats. Let's get a
Thanks so
playing
much.
card, like a baseball card made for you.
Oh, that I am into that. I just got so excited.
Menstruators we love.
Amazing. Can't wait.
This is a checkpoint within Bleeding Disorders Awareness Month, within the Bleeding Disorders community. You and Stacy both have a bleeding disorder, but they are both very different. To the layman, how are they related?
They're like cousins. Like my cousins. Literally.
Because they actually have bleeding disorders.
Yeah, they do.
I get it. If I was to be like, hey, what factor are you missing?
Yeah, I'd be like,
factor are you
hey,
missing?
factor 8. So it's like that line is hilarious, but then I'm like, but for clarification, I'm missing, I'm deficient in factor 8 and she's deficient in factor 7.
And if people were to wear their deficiency numbers, it's more common that there is a factor 8 deficiency amongst those who are factor deficient.
Correct.
Which is why we call factor 7 deficiency extra rare.
Extra, extremely, super rare. I continue to be struck by and impressed and inspired by the advocacy of women in this beautiful bleeding disorders community and freaking women at large right now. Like, let's keep going. We have to keep being loud and get our needs met.
Do you hear the people sing? I hear them singing the song of angry menstruators. Let's listen in to the full interview. Yeah, definitely like the adamant persistence that's necessitated by the world as it is. Yeah, you do just have to keep going. And the research you mentioned that's helpful, the constantly changing evidence-based research, is that of benefit that it constantly changes when you're on these calls? Are you able to say, listen, yeah, you don't have the newest thing and I do, and can you send, does that have an impact? Does it?
Sometimes it has an impact because sometimes these doctors are not necessarily reading the research week to week. I am somebody who has had access to the research week to week because I was a graduate student and because I've done so much education. But as the average everyday person, it's hard to get access to these articles. And luckily there's, organizations like the National Bleeding Disorder Foundation that are compiling research. There's the Chest Foundation, there's Fair Time for Women. All of these organizations that deal with advocacy, they are starting to compile articles that you can access for free.
Do you contribute to any of those organizations?
I do. I am on the board of directors with the Chest Foundation. I'm also active with the Fair Time for Women Coalition. And this year I have had the luxury of being at NBDF, or the Bleeding Disorder Foundation's, annual meeting. So for me, I'm very involved with the rares, especially the factor 7s. However, I've also been at the Hemophilia Foundation of Michigan's Women's Conference twice. I'm very much in the background, but if people come to me and they ask me, hey, can you find me research on this? I will happily find them the research and I will send it to them. So it's one of those things that I'm constantly available to people. If they need access to these articles, I can get it to them. Usually within a couple of days, I can get it to them.
How do people find you for that? We'll put that in the show notes. People can need that.
The biggest way to get me, Facebook. There is a women bleeders group that I'm one of the admins in. There is the Factor 7 group. If you are a Factor 7 deficient patient and you're in the Factor 7 group, reach out to me. I'm the only person with my name in the world. So if not, otherwise, Chest Foundation has a website. You should be able to either get in contact with Chest and have them get to me, or you'll be put into contact with either Janet or Eric, or even some of the other board members, depending on who's looking at the emails. But generally it's Eric or Janet who are the head of Chest, and they should be able to find me, and I should be able to get the article for them.
Going back in time, what do you have something you would tell a teenager with factor 7 deficiency who has no idea what they're about to learn about their own body? Is there anything you would tell younger you about?
Oh man, there's so much. There's so much, because I was late to the party with factor 7. I was diagnosed at 17, which again is early on the female standards of being diagnosed because the average age is usually in the 30s, sometimes later. But the biggest thing is that when you say there's something wrong with you, chances are there is something wrong with you. That is the big takeaway. And I am very fortunate that I have had doctors. My first hematologist was great. She sat me down. She told me, I have never seen one of you in my life. I've read about you in textbooks, but I have never seen somebody with factor 7 deficiency. And I'm not 100% sure how to treat you, but let me find somebody who can tell me how to do it. And she was great. And she contacted Yale, and Yale was able to get her the information, and we were able to order the Novo 7 for my surgeries. But again, you have to find the doctors that are willing to listen, and that takes time. You're the person who's hiring the doctors. They're not hiring you as a patient. You're hiring them. If you don't like one, find another one. There's always one out there who's willing to listen.
All good advice. It takes time. Keep it going. Hire your doctor. Keep looking.
There's no other factor 7 product other than Novo 7.
Well, there you go.
So, I mean, there is products in the pipeline currently. But as far as products, though, for factor 7s, Novo 7 is the big one. And it is expensive. It is hard to get, and it is expensive. And doctors are scared of it. And yeah, it's not like the factor 8 and the factor 9 people who have multiple products and options to use. With factor 7, it's the only clotting factor that is not actively circulating in your blood. So the only time that factor 7 is active is if there's tissue damage. And for that to happen, something needs to happen. Some sort of injury or trauma. You know, that
diagnosed, yeah.
It makes it really hard to get diagnosed. And because factor 7 is so short life, it's got such a short life to it that the medication only works 4 to 6 hours. It's not like you've got a factor 8 person who's got a clotting factor that works for, 36 hours, or even these 1 week long half-lives. Novo 7 only works 4 to 6 hours. So when you're using it, they don't like to keep giving it to you unless you are somebody who is a singular number for a percentage. 2%, 5%, 10%. And factor 7 alone is really hard in the sense that our percentages don't correlate with our bleeding patterns. We have people who are 50, 60% who bleed like severes, and then we have severes who are 1% who don't bleed at all.
When the severe distinction, then what is that referring to? Severe in the blood work.
So severes are usually people who are less than 10% for factor 7. But
don't bleed at all, necessarily. Might not.
But they're starting to move away from the percentages and move towards the bleeding symptoms, where if you had GI or any sort of central nervous system brain bleeding, you'd be labeled as a severe. Doesn't matter what your percentage is. If you've had a brain bleed or a GI bleed, they would start to look at moderate to severe. So they're starting to move towards a different way of categorizing us, but it's still really difficult for people who have a qualitative defect because our testing is not exactly accurate. All of our assays are developed with either animal tissue or other human organ tissue to get a percentage. So our numbers are not necessarily accurate. In my own variant, I test at 65%, but inside me, I am probably closer to 30%, which I've done the mathematics for it, which is it's a whole nother rabbit hole that I can go down and nerd about with somebody else. But the percentages when you have a clotting time that is prolonged on a PT is at least 45% or lower. Mm-hmm. And every time they test my PT time, it's either borderline normal or it's slightly prolonged. And when you start doing the math for it, I'll test at 65%. Like when I was with Cornell this past year, I tested at 64%. And I did the mathematics. They went, I'm not actually 64%. I'm more about 32 to 45%. And I can prove it.
And we're all glad that you are able to and that you will, because it takes the kind of brilliance that you have for such mathematics to help move the needle for sure.
Yeah, and that's the hard part. And I actually wrote a letter to my doctor at Cornell saying, hey, even though I'm testing at 64%, these other testing that you've done with the PT time, I am able to prove with your PT time testing and my factor percentage that I'm not actually this percentage. And here's all of the information as to why, and here's the articles attached to it of why this is incorrect. And here's the most current research from the person doing the research, Dr. Nugent out at Children's Hospital of California, Orange County, California. Here's the person who's doing the most research telling you that they test at 65%, but they're a qualitative defect with this gene mutation.
We are, again, grateful that you are doing the research and the mathematics. It does take so much effort. It's a full-time job, and here you are doing it of duty to yourself and maybe to others. Thank you for sharing what you have.
We are so grateful that Stacy shared their story with us. And you can check out our Calendly in the show notes to schedule time to share your period pain and advocacy journey too.
Yes, please do. We're here for you. We want to talk about it. We know it helps to talk about it. But that's it for now on Flow. Check out those program notes for how to get in touch, and we'll see you next month.
That was good.
I want like a Flow Pledge of Allegiance.
I pledge allegiance.
Pledge allegiance.
To my vulva.
Yes, to my vulva.
And her ovaries and cervix.
And the vagina that stands between the outside world and inside world. May she stay clean and well.
And happy and pleasured.
Amen. I guess it's more of a prayer. I pledge allegiance to that menstrual prayer. That's what I'm saying.
Mm-hmm.
I do pledge allegiance to the vulva.
Everyone should pledge allegiance to the vulva.
Yeah, even
Boom.
not their vulva. That's
Right.
it. It's not even about my vulva.
The vulva. The collective vulvas.
Okay, I'll stop recording. I think we got it. Flow is produced by Bloodstream Media. Big shout out to our creative director, Amy Board, and our editor, Kay Vermeil. New episodes of Flow will be available the second Thursday of every month.
Hey, that's the day after I start menstruating.
And thanks to our sponsor, Takeda, for their support of Flow.